And then would you like me to share my screen at this point?
No, not
Okay.
yet.
Okay.
Let me do my intro.
Okay, perfect.
Good evening, everyone. Welcome to our third research club in 2023, hosted by the Brain Health Center of the Rockies. My name is Kathy Kiefer, and I'm the co-founder, along with Dr. Augusto Miravalle, and the president of this nonprofit organization. For those of you who are new to Research Club, this is a program that brings the latest developments and recent academic journal articles, and we have them explained in a way anyone can understand by a panel of experts in the field. Research Club is a free program to participants and is held 4 times throughout the year on Monday evenings at 5 p.m. Mountain Time. This session will last exactly 1 hour long. For our final Research Club as part of this series, we will be discussing exercise and brain health. Topic has changed, but this is a topic that appears to receive a lot of attention these days. That session will be held on November 6th. Hopefully, all of you are equally excited about tonight's discussion on nutrition and brain health. We will be diving into the latest research studies and what the right diet might be to help promote brain health. Our guest speaker is Bailey Carr. She is a registered dietitian nutritionist, RDN, specializing in culinary dietetics. She completed her undergraduate degree and dietetic internship at Ohio State University and recently completed culinary school in Boulder, Colorado. In her current role, she is a staff dietitian at Colorado State University's Kendall Reagan Nutrition Center and is part of the program's expansion into Denver at the university's Innovative Spur campus. Our moderator and co-chair for tonight's research club is Dr. Augusto Miravalle. Our other co-chair, unfortunately, is unable to join us this evening. That is Dr. Brett Flang. Today's event is being recorded and will be made available via our website within the upcoming days. For today's session, I would welcome you to use the Q&A box at the bottom of your screen to ask any questions you may have, and we will allow Mrs. Carr to answer as many of those questions possible within the time frame allotted. Before I turn this over to Dr. Miravalle, I would like to recognize our sponsors for Research Club this year, which include EMD Serono and Bristol Myers Squibb. You can visit these companies and their products via our virtual exhibit hall on our website. At this time, Dr. Miravalle, I turn it over to you.
Thank you, Kathy, and thank you everyone for joining. I feel that we've been postponing this topic for the last year because it was difficult for us to find the right person, and I think we did today. I'm so excited to welcome Bailey to our series. And this is, as Kathy mentioned, a very popular topic. I have to say, in clinic, when I see patients, they always ask, what is the right diet for brain health? What can I do to improve my chances of keeping my brain healthy? And in a sense, also it's good timing because for many years, we didn't have data. We didn't have true research evidence that could guide us in terms of advising patients on what is the right nutritional approach. But most recently, I will say in the last decade, research has translated from animal models to humans. And now we are starting to collect evidence-based that allow us to truly understand that connection between the gut and the brain. And I'm really excited because that's the topic that Bailey is going to cover today that goes beyond just simply saying, hey, you need to eat healthy because we know that it's good for you. But this is now a biological reason that connects what we eat to how the bacteria in the gut, in a sense, behaves and how that translates to immune responses and how those immune responses interact between the enteric nervous system, meaning in the gut, with the central nervous system. So without spoiling too much of today's talk, I'm going to start today's conversation with Bailey, asking you a very generic question, Bailey. You're an expert in nutrition and you're working now in the neuroscience space. So of all the research updates and publications that you become across in the last decade, what would you say are the critical ones that you would like to talk today?
Sure. So some of the studies I will be sharing with you all today, and now let me share my screen, so you all can see them. Can everybody see this okay? All right, so of the studies we'll be looking at, I've selected 3. Let me allow you to meet them. So one will come from Nutrients. It is titled, a review article titled Dietary Patterns in Alzheimer's Disease, and updated, and now I can't see my screen, I'm sorry. 1 second. An updated review linking nutrition to neuroscience. Next, a review article from Cells titled The Gut-Brain Axis as a Therapeutic Target in Multiple Sclerosis. And finally, we have yet another review article titled Whole Food-Based Approaches to Modulating Gut Microbiota and Associated Diseases.
Excellent.
Right.
Well, those are great articles. And if you can maybe kind of start explaining what you learned from these articles.
Sure. And I have this presentation set up so that each topic I addressed will be linked to the article that I'm pulling the information from. So the first question I want to start with is what style of eating is the most brain protective? And I'm going to use this article from Nutrients to help answer this question. This article mapped out 5 different eating patterns or total diet styles associated with brain health. And those include the MIND diet, the vegetarian diet, the modified Mediterranean ketogenic diet, the DASH diet, and then the Mediterranean diet. And so we want to examine what components of these are helpful, what components they all share, and maybe what components are unique to each diet and why it would be beneficial. I also want to take a moment here to pause and clarify. When I use the term diet to define these eating patterns, I don't mean a diet that you are prescribed, that you have to stick to for 6 to 8 weeks to attain a short-term desired result. These are much more than diets. Yes, they're the food that you consume in your diet, but these are overall lifestyle patterns that can help configure your pantry, help determine how you order when you go out to eat. These are truly the habits you do in the daily to maintain health. Why this is so important is because, especially in diseases like Alzheimer's, we know that symptoms appear 20 years after the initial brain injury or after the initial kind of dysregulation in the brain. So we really want to practice, and as a dietitian, we really want to encourage lifestyle changes and patterns that you stick to for the long term, because that's the only way for food to really be protective to the body when there is that long-term exposure. I think it's like a personal thing to get rallied up about, but I think that, in our current media landscape and what we're bombarded with, there's a lot of clickbait and articles of, hey, try this, this will prevent Alzheimer's, this is the best diet for brain health. But the question to pose is, are those, 1, really healthy, and 2, are they really sustainable to reap all of the benefits? So now in this slide, I have broken down each of these different studied diet patterns. We will discuss, of course, as mentioned before, the unique qualities of each, but I also want to draw everybody's eyes to this bottom column of what they exclude and limit. We'll talk more about it here. I don't want to get ahead of myself, but you may start to notice this exclusion criteria is going to be pretty similar. But to break it down, we have the DASH diet, which stands for Dietary Approaches to Stop Intervention, or just to stop dietary approaches to stop hypertension. The basis of this diet is going to be lots of fruits and vegetables, whole grains, nuts, beans, low-fat dairy, lean meats, really foods that are high in calcium, potassium, and magnesium. It's going to limit a lot of the refined carbohydrates, which translates to carbohydrates that don't have that outer bran included. So a lot more of white flours, low fiber choices, high sugar foods and drinks, high sodium foods, alcohol, red and processed meats, and saturated fat. These topics or some of these words will be repeated. So now's a good time to mention that saturated fat is typically fat that is solid at room temperature. It is generally speaking animal derived. So this is butter, full fat dairy products, or red meats, or even the skins and fatty components of any meat or any poultry.
So Bailey, you're pretty much telling me that no bacon, try to avoid the fat in the red meats, limit alcohol intake. So my upbringing in Argentina, pretty much, it was doing all the wrong things there, right?
That's what I can't deny any cultural foods, but I think as a chef and a culinary dietitian, this is where we'd maybe look at these foods to be less of the staple and center of the plate, but more of the garnish, the flavor, the accent. To tie this back into sustainability, we need to make sure these diet patterns can be done for the long haul. If they're extreme and extremely exclusive, we're probably not looking at the long haul. So next, we have the Mediterranean diet. So same DASH staples, extra emphasis on fish and seafood. Olive oil is going to be the main fat source, what a lot of foods are cooked with and topped with. There's moderate amounts of dairy. A lot of the dairy is fermented or aged. So we're looking at yogurt or different unprocessed cheeses such as Parmesan or feta. Everybody loves the Mediterranean diet because of this next point. It includes moderate amounts of red wine. Moderate is defined to 5 ounces a day for women and 10 ounces a day for men. I really won't repeat all the exclusion criteria because you'll notice it's very, very similar across the board. The MIND diet. Now, this is the one I always stumble across because when we say the full thing, it's quite a mouthful. But the Mediterranean and DASH intervention to prevent or slow neurodegenerative delay. And I believe this came out of this, the research for this, or it was developed out of Rush University, which is where you are, Augusto.
That's correct. Yeah, that's correct.
Okay, wonderful. So everything's building off of each other, same staples as the DASH and Mediterranean diet, except there's really going to be an emphasis on making a lot of your vegetables these leafy greens, and a lot of the fruits are going to be berries. It is different from the Mediterranean diet, it is going to limit alcohol and recommends not consuming alcohol or doing so very rarely. To start to take this into a controversial area, we're going to talk about the modified Mediterranean ketogenic diet. Why I say this becomes a hot button topic is because of the keto diet. This is a source of a lot of clickbait, and it's a lot of circulating rumors that keto is the healthiest. I think keto is a term that gets thrown around a lot without knowing what it really means. But the ketogenic diet principle is one that is very low carbohydrate. It's meant to shift the body's fuel from carbohydrate, essentially blood sugar, to it's going to use ketone bodies derived from fatty acid breakdown. That's a lot of nutrition science behind it. But if we're going to look at this modified Mediterranean ketogenic diet, it's going to be 5 to 10% carbohydrate, which is somewhat liberal compared to a true ketogenic diet. It's even lower carbohydrate than that. But you'll see the carbohydrates here, it's still a very small percentage of the diet, which can make it hard to stick to. It's going to, the predominant foods in the diet are going to be fat sources, and then there's a moderate amount of protein. The fat sources in this modified Mediterranean version are going to come from olive oil, avocado, nuts, and fatty fish. This is different from the way this social media ketogenic diet tends to overtake, where it recommends a lot of recipes with cream cheese and full fat cheese and red meat and bacon and sausage. Can that be low carbohydrate? Yes. Can your body go into ketosis with that type of diet? Yes. But can we say that's going to promote long-term health benefit? Not necessarily, especially if there's not a lot of colors involved in the diet or a lot of varied fruit and vegetable sources. So of all the ketogenic diets to take on, this Mediterranean version will be the healthiest option. So this is really going to restrict, to be clear, maybe good things to restrict, such as high sugar foods and drinks, but it's going to be very restrictive of all carbohydrates, which can include high fiber carbohydrates. And we'll talk later in the session why that may not be so beneficial in terms of the gut microbiome. And then finally, we have the vegetarian diet. This really isn't as specific as some of the other diet patterns, such as the DASH or Mediterranean. It really just refers to a plant-based diet. You may include dairy and eggs if you're a lacto-ovo vegetarian. What we do want to be considerate with if you are following a vegetarian diet is that you are consuming adequate amounts of protein and consuming B12 may be in the form of supplements. B12 is a critical nutrient for brain health in the prevention and mitigation of Alzheimer's especially. And it's unique in that we can really only source it from animal products. There are some vegetarian products such as nutritional yeast, but if you are vegetarian, you do want to talk to your doctor about this, do a blood draw to see what your levels are, and you may have to consider B12 supplementation. All right. So this image was pulled from the research where it may look a little bit wordy, but to break it down, we know if we have this at least 20-year long-term adherence to a healthful diet pattern, we're going to have lots of exposure to antioxidants. We're going to really benefit our gut microbiota. We're going to decrease risk in incidence of neuroinflammation. We're going to help prevent against other factors that could cause or be detrimental to brain health. We know that these diet patterns, a lot of them are designed to be heart healthy, but they're also designed to promote blood sugar regulation and prevent diabetes. When we can mitigate those comorbidities or prevent them, we're much more likely to also protect the brain and prevent neurodegenerative diseases. So we can couple these protective diets with the long-term adherence to them with non-dietary parameters, such as lifestyle activities, having an active lifestyle, including exercise, doing those mental gymnastics and brain games, and practicing mindfulness. And we're predicting that there will be a slashed risk for cognitive decline.
So Bailey, if I understood correctly, what you're kind of bringing up here is this concept that the diet is one element of this whole battery of activities that or lifestyle interventions that we can promote for brain health, but it's not the only one. And most importantly, it's almost as important what you eat, but also how you incorporate that into your life, right? I mean, 6 weeks of a healthy diet perhaps is not going to be as beneficial as having a 20-year plus intervention that is part of your lifestyle. Is that correct?
Absolutely. It's definitely multifactorial. There's lots of components, and this is what makes the area of study of brain health quite complex as well. Even if nutrition is perfect, what other factors are affecting total brain health? And we know we're looking at lots of areas, and the healthiest and most optimum practice in many areas that affect lifestyle to have the most beneficial outcomes long term. All right, so something we mentioned looking through the inclusions and exclusions of all the diet patterns, but I think that continual food for thought is just going to be continuing to ask yourself, is it the extremes of each diet that promote results, or are the results really found in the overlap where many diets share the same inclusions and exclusions of food? It's always good to come back to this as that middle ground in between the pendulum swing of, oh, well, I feel like I'm eating this way and it could pose risk. So I want to swing to the other end of the spectrum and eat this way, but that might be sustainable. We want to practice this middle ground of getting away from the extremes. So if we're staying away from extremes, let's get into it a little bit more. What do all of the eating styles have in common? So these are the food components related to brain health. They include polyunsaturated fatty acids. Really quickly, I might zoom out a bit. When we talk about these fatty acids, briefly mentioned earlier, saturated fatty acids come from animal proteins, typically solid at room temperature. They tend to be pro-inflammatory and pose risk for neurodegeneration over time. But if we're not talking about saturated fats, we're talking about unsaturated fats. These come from plants, largely plant sources, but also fatty fish. Generally speaking, these are liquid at room temperature. We don't have to get too into it, but there's polyunsaturated fats. This category includes the omega-3 fatty acids that are found in fatty fish, walnuts, flax, and chia. These are really hailed for being anti-inflammatory, and they are important to include in a brain health diet. We then have our monounsaturated fatty acids, also very beneficial for the brain. The staples largely of the Mediterranean diet, such as olives, olive oil, avocados, and nuts. I've seen for some reason in the media lately, a lot of articles saying stay away from nut and seed oils, avoid these at all costs. They are pro-inflammatory. And we really don't have evidence that suggests that. Overall, our longstanding evidence is all the food sources I have mentioned from these unsaturated fatty acids so far have been proven to be protective to the heart and also protective to the brain and really reduce incidences of disease. So if you see those articles and those headlines, know that there's more digging to be done, and they're likely just meant to capture attention and be a little polarizing, but these foods are absolutely dietitian recommended. More food components related to brain health will be fiber, fiber from a wide variety of sources. This could be whole grains, beans, all different fruits and vegetables. Eating a wide variety of fiber sources means that you will have a wide variety of good microbes in your gut. Which we are building towards getting more in depth in that information. B vitamins are extensively studied to be protective and healthful for the brain. Specific vitamins to look for include folate, B6, and B12. B12, a concern for vegetarians and vegans. If you regularly consume animal products, less worrisome. B6 is found in a wide variety of foods, including chickpeas, eggs. It's in a lot there. B6 is in a lot of meats as well, but also a good amount of vegetable and vegetarian foods. And then folate is a really important nutrient for Americans because it's found in a lot of leafy greens. So this is one of the ways those leafy greens in the mind diet become really protective. And finally, with these components, phytochemicals. This is a big word that really means compounds that specifically come from plants. So you'll find them in berries, orange, red, and green vegetables, soybeans, spices, tea, red wine, coffee, and cocoa. So how do you choose the right dietary pattern for you? Choose the pattern you can stick to for the long haul. Eat as many plants with as many colors as possible. Focus on high fiber carbohydrates. I would not recommend eliminating carbohydrates, but really tuning into this fiber component. A great indicator something is high fiber is if it has 3 grams or more of this fiber per serving. A daily intake should range from 25 to 38 grams per day. And then some general tips when you're buying pre-made food, look for options with lower levels of added salt and sugar. Look for total days intake. We're aiming for less than 30 grams of sugar per day. For salt, less than 2,300 milligrams per day, which is actually equivalent to 1 teaspoon. And for some populations, the recommendation would be smaller, aiming to consume less than 1,500 milligrams of salt per day. Then just a reminder once again, how we fill our tank long-term matters, especially for diseases associated with aging. We want to set ourselves up for the healthiest aging possible.
So Bailey, one of the things that I'm really excited of having you here is because you almost have that dual perspective on nutrition. You're a registered dietitian, but also you have formal training in the culinary arts, which brings a really nice combination of saying, well, I know the science behind, but I also have formal training in how to, right? Not only the why, but also the how. So if you have to advise any of us here, if we have some sort of bad habits in nutrition, where do you start? What are the first things you need to do? Do you start with the don'ts? Do you start with the do's? Do you do both? And how do we start here?
You start, one, of course, I have to say, set up an appointment with a registered dietitian. If you're in Colorado, the Kendall Reagan Nutrition Center, but I think this is the best way to really have somebody work with you to fine tune your personalized therapy. It's going to look different for everyone. Everybody has different hurdles, and sometimes you just need somebody to come alongside you and help dismantle and break down those hurdles in a individualized way. But to answer the next part of your question, I recommend always focusing on addition instead of subtraction. If you take all the foods you love out of your diet, it's going to seem impossible. Let's work on the small changes. What can we add in? What can we try? I think in terms of, I can talk to that on foods of, well, start shifting the plate to have this component ramp down and maybe colorful fruits and vegetables take its place, but we're not removing anything drastically. So that's one part of what you can add in. But as a chef, add in different culinary techniques. Try cooking things in new ways that you may find them palatable. Really popular one here is vegetables. I don't want to go on a tangent with this because I can, but a lot of people maybe like to steam vegetables or boil vegetables, and you hate vegetables and you don't want to put them on your plate. But maybe if you try a dry heat cooking method, like putting vegetables in the air fryer, roasting vegetables at 425, you're going to caramelize the sugars in them. They're going to get nice and crispy instead of soggy. And maybe that's a behavioral intervention to add in versus doing anything drastic where you find, oh, wow, I actually like that, enjoy food this way. So let's get into this high level stuff of how our gut and brains interact and why it's significant. For the sake of time, I've already introduced this article. I won't rename it again, but this is where I'm pulling a lot of the info from, or these two articles. This is really interesting to share. And putting together this presentation, I did come across this article that came out of Harvard that explains that this area of probiotics and prebiotics in the gut microbiome is so interesting because when a drug is taken, its concentration is in the bloodstream, peaks after the initial dose, but then it goes down. But if we can harness the beneficial properties of our gut microbiota, we essentially have this little medicine factory within us that's constantly producing beneficial components and active compounds, which is quite relevant and important when we consider these lifelong chronic diseases that need constant treatment. So there's really a lot of promise here. But to break it down, I especially see this because it's promising. There's great researchers and doctors behind it. There's also marketing behind it where people know it's interesting and that there's, we're willing to pay for things that are promising. So I see a lot of terms get thrown around that aren't super accurate. So let's demystify this a little bit so we all know what probiotics and prebiotics in the gut is and how to treat it appropriately. So what is the gut? It's the lower part of the digestive system, the large intestine and colon. It houses trillions of microorganisms within us. And it's really the site of the final stages of digestion, including this, it's where the microbes are going to digest the prebiotics that they use as fuel. For understanding this gut microbiome, something we can relate it to is a garden. Our gut, so our gut now is the garden, it's our flower bed. The probiotics are the seeds that we want to grow within it because they're going to provide benefit. So they're living organisms that provide benefit to the host when they're ingested, but we don't just ingest them through food. Really, they've been introduced and they've populated within us since the time we were born, based off of our birth method, how we were fed as infants, what childhood exposures we had, and then certainly the food we eat. That's how they were established in our gut. Certainly when it comes to probiotic foods, they are fermented foods. So this includes yogurt, kefir, tempeh, sauerkraut, kimchi, and kombucha. These foods are quite untraditional in the typical American diet, so are good foods to slowly acclimate to and begin experimenting with and adding in. And now to keep these seeds alive, if our gut is a garden, just like anybody who has a garden at home, you can't just plant the seeds and be completely done with them. You have to tend to them. So that's where prebiotics come in. They're the preferred source for they're the preferred food sources for our gut microbes. It's also, through the research we have so far, it's hypothesized that these may be more important to regularly consume as opposed to even taking probiotics, because they're just going to continue to nourish and grow these seeds and these populations. So what are prebiotics? There are different types of carbohydrates. There are fibers, cellulose, which is found in fruits and vegetables and really all plants, pectin, a big word here, oligosaccharides. You may see this on food labels, labeled as FOS or GOS, fructooligosaccharides or galactooligosaccharides, inulin, lignans, and resistant starches. I wanted to list all of these by name because you may see a product at the grocery store that says it's prebiotic. So when you flip it around and look at that label, you want to see one of these listed to confirm that it is in fact prebiotic. Polyphenols, so those different types of phytochemicals or plant compounds found in colorful foods, our probiotics can digest those and use them as food. So in common language, what you want to include in your diet to feed those seeds, the prebiotics are the Miracle-Gro. We want to look for beans, onions, apples, broccoli, whole grains, pears, celery, potatoes, berries, carrots, tomatoes, squash. So you see really any fruit, vegetables, or grain. The reason I bolded whole grains here is just because we're still in this keto era where everything is grain-free, low carbohydrate, no carb, etc. But if we rob ourselves of carbohydrates and fiber, we rob our gut garden of the Miracle-Gro that's really going to produce benefit. So research is emphasizing we want to include these foods in our diet for a healthy gut. And now finally, these aren't necessarily prebiotics, but vitamin C, D, and E are associated with increased populations of good bacteria. So there's definitely a synergistic effect of lots of healthy foods within the Mediterranean MIND diets are going to be rich in fiber, but also rich in these vitamins that are going to help sustain and protect our gut.
So Bailey, I really like your analogy of the probiotics and the prebiotics of the seeds in the garden and the nutrients to the seeds. And I have to say that when you mentioned kombucha, both Kathy and I giggled because she's been trying for the longest time to make me like kombucha, and I just cannot get used to that. But I guess I will continue because it seems like it's good for you. But is there anything that we can do that is wrong for the bacteria? Is there any damage that we can create by the things we do?
Absolutely. And I might skip ahead a few slides because this is getting in the weeds a little bit. But what we can do to protect the gut and not introduce harmful things, we can avoid smoking, alcohol, processed foods, and foods high in sugar and refined carbohydrates and low in fiber. Studies are still not quite conclusive, but there's emerging evidence that a lot of the components of processed foods, such as preservatives, emulsifiers, and artificial sweeteners, maybe especially Splenda and stevia, even though stevia isn't artificial, these could possibly eradicate a lot of the good bacteria and contribute to this next slide of gut dysbiosis, which is a term, a kind of a general term that means our gut microbiota isn't that rich or diverse. There's not a lot of different seeds and plants being established there. Maybe the weeds are taking over, the bad players, the bad bacteria are gaining more ground than the good components, which can create a pro-inflammatory state that favors neurodegenerative disease. Plays a role really across many disease states, such as MS, Parkinson's disease, and Alzheimer's. It is thought, with this emerging evidence from the research studies, that diseases such as Parkinson's or multiple sclerosis emerge from the gut. They actually emerge possibly from this gut dysbiosis that stimulates systemic inflammation and triggers brain inflammation. And the brain and spinal cord are incredibly susceptible to this inflammation. So really we can get ahead of that or protect it if we just have a robust gut garden and keep the weeds out and keep those wonderful flowers in there and well established. So once again, I feel like I really went on a tangent there, but those triggers, smoking, alcohol, processed foods, really one of the best ways to just keep your gut garden growing is with fiber and a variety of colorful fruits and vegetables. You can practice methods for stress reduction. It is thought that the stress we experience can travel down and actually change our gut microbiome in an unfavorable way. And then when we think about repopulating or benefiting the gut microbiome, we get to this kind of controversy that research still hasn't fully described yet of should we be taking probiotic supplements? And as mentioned before, we don't know. Some studies say, yes, take them. They are helpful. They're associated with benefits in patient populations. Other studies say, no, they're not. There's really no effects. And we know they're quite expensive. So it's that question of ethics of, is it correct to recommend these high-priced supplements when we don't have the full evidence behind them to say we should be focusing part of our income on them. And then it's also fair to say, if we're going to take probiotics, but maybe maintain diet and lifestyle activities mentioned above that could eradicate the good bacteria, we might be nullifying this or canceling out the effects of those probiotics. So is it best if you're concerned about these diagnoses or you are living with the disease and want to mitigate it, is it best to jump into taking a probiotic supplement? Probably not. We want to get back to the foundation of diet and those anti-inflammatory diet patterns and a high fiber diet.
This is excellent, and perhaps a good time to remind the audience to pose your questions through the Q&A or the chat box. Either way, we'll get those questions asked. We are kind of like 20 minutes away from the top of the hour, so I want to make sure that if anyone has any burning questions, we have plenty of time to address those. And I like where you're going here, Bailey, because you introduce stress reduction, and that's one of those lifestyle interventions that it's hard to quantify, but we all know when we are stressed. And that reminds us that the gut is not in isolation, right? So all these wonderful seeds that you planted, all the food that you're giving, the bacteria that grows there, are in direct contact with two main systems that have a profound effect on brain health, which one is a lymphatic system and the other one is a nervous system, right? So we have all sort of nerves around the gut, and those nerves are actually, in a sense, channeled to the brain through one main nerve called the vagus nerve. And there is a lot of interest going on now in trying to understand that connection between the enteric nervous system and the central nervous system, that communication between the two. And in the case of disorders like multiple sclerosis, but also in Alzheimer's, where there is an immune-mediated mechanism, Also, we need to remember that there are lymph nodes around and the entire lymphoid system that is around the gut that perhaps plays a critical role in starting that immune reaction, immune response that perhaps starts peripherally and then travels to the brain. So hopefully this serves as a segue for your next section, which is trying to kind of put that into practical terms. What is this gut-brain connection?
Yes, no, thank you so much. So how can the gut help in neurodegenerative diseases? One, they can help by activating many plant compounds that aren't activated on their own when they eat them, not until they hit that gut garden. And when they're activated, they have antioxidant, anti-inflammatory properties in the body. And then these microbes, they create or produce these active compounds. So the probiotics, our seeds, when they're nourished with the prebiotics, our Miracle-Gro, the fruit they produce are a lot of these active compounds, such as short-chain fatty acids. It gets really technical and sciencey here, but basically these components that are actually capable of crossing into the brain to provide benefit. So to link back to that Harvard study at the beginning of this, these are the components that can create that steady release of beneficial compounds within the body to help mitigate these disease states.
So sorry to interrupt, but we have two questions coming in the chat box, and perhaps we can answer them both because they are somehow related. Roxanne is asking about any recommendations on the brand of vitamin B12 and whether you recommend getting the actual shots or the tablets for MS patients, and be happy to cover that too as well. And the same with magnesium. Joanne is asking how much should we take?
Okay. I want to direct both of those questions back to medical providers that you see. The only problem here is I can't see your full health chart and know everything that's going on. So I want to keep it very generalized to not even become dangerous. But with any supplements, I'm going to stay pretty vague. Say if you are taking supplements, the most important thing to do is make sure it's third-party tested and verified. This doesn't mean that the third-party verifiers say that the supplement will work or will do what it claims to do, but it means that it doesn't have any surprise ingredients or impurities in it, and the amounts of the ingredients it lists is true. So these third-party verification companies or labels even to look for on supplements would include something like National Science Foundation, NSF. I know you can also log on to Consumer Labs and see what supplements are third-party tested and verified. So in terms of correcting any deficiencies or knowing what doses to take, please talk to your doctor first.
Absolutely, and we can always check those levels, and truly the difference between intramuscular or oral sometimes depends on those levels, and also any other associated disorders. Some people have malabsorption of certain vitamins, and in that case, we may have to bypass the oral route and just go straight to intramuscular. So the right recommendation is talk to your healthcare provider. And now Steve is asking if taking supplements could be harmful.
If taking supplements could be harmful.
Mm-hmm.
Is that yes, that's what it is not the best practice to just go ahead and take supplements to try to correct deficiencies or calm down side effects. Go ahead and of course start with the dietary recommendations first, which it can be even helpful to talk to the dietitian about those, and definitely avoid taking supplements unless you have a doctor's supervision, because they absolutely can have adverse effects in the body in a variety of arenas, whether with kidney and liver health. Maybe they can't even be, there are some studies that show they can be damaging to the gut microbiome when we take in too many things in excess, even if they are theoretically good. Everything is dose dependent, and we want to be mindful of that and always just start with food first.
Excellent. And last question on vitamin B12, I can answer, Jonah. So the levels of vitamin B12, the lower limit of levels is 286 milligrams per deciliter. But as many things in medicine, we don't just look at the level itself. Some patients may have symptoms of vitamin B12 deficiency, even if they test within the normal range. So we want to do a careful history, take a good exam, and then put those levels into account. Sometimes we recommend to supplement even if the levels are within that normal range when patients may have symptoms of vitamin B12 deficiency, which I'll be happy to talk offline of what those symptoms are. But that's also another quick thing that we can do: check the levels and talk to your primary care physician or neurologist.
All right, so we are coming to the end of this presentation, but what do we know about clinical trials and probiotic supplementation, specifically in MS? But there are some studies looking certainly at Alzheimer's and Parkinson's disease. But across the board, we lack sufficient evidence to suggest the appropriate dosage, strain, frequency, and duration of probiotic therapy. For these to be helpful, more research is definitely needed before we can know the answers to these. But hopefully, it's not too far off in the future. There is promise, now this is specific to MS, but that promise in small studies that probiotic supplementation may help decrease inflammatory markers, pain, fatigue, and depression associated with this disease. So what that translates to is maybe helping with the activities of daily living or increasing quality of life. We can't say that these probiotics are going to completely prevent or cure the disease. So now we're going to look at putting the recommendations in practice. We're getting away from the hard-hitting science. But with a lot of these diseases affecting brain health, it can impair the activities of daily living, which makes it even harder to put these recommendations in place, even if we know what they are. So how do we think about feeding ourselves or making the way to even consume healthful foods? We want to look at assistive kitchen technology, such as automatic can openers, even these rubber mats that prevent your equipment from sliding around and can hold it in place for you, so it's just less strength and exertion needed to even hold on to kitchen equipment. There are knives that have a different grip on them that are easier to use. Definitely the assistive and kind of attaching silverware, jar openers. You can also consider lightweight cookware, two-handled pots, utensils with rubber grips to help hang on to them. And then there are 3 links here. Are we sending out this presentation to everyone afterwards?
It will be posted on the website. Yes, it will be available to everyone.
So that way you can follow these links to see where to buy some of this assistive kitchen technology and just research additional ideas for helping in the kitchen. Here are a small compilation of recipe sites that do have recipes according to DASH, Mind, Mediterranean, etc. Of course, first is the Kendall Reagan Nutrition Center recipes, but the Mediterranean dish is wonderful, especially if you're feeling a little bit experimental of trying new cultural dishes. Eating Well is a dietitian approved recipe site. If you are a foodie, you may enjoy the New York Times cooking site, and then there's the USDA MyPlate site. Of course, the kitchen can always be a barrier of just preparing meals. So what are some meal services we can look at? There will be meal kit services, which include HelloFresh, EveryPlate, Gobble, Green Chef, Blue Apron. They have a wellness series. Pre-made meals that come in little Tupperware to your door would include Modify Health, Territory Meals, and Factor. And then a little bit more accessible options, just if you're already at the grocery store, would be looking for Kevin's Natural Foods. These are oftentimes different types of chicken already prepared in a sauce with a very nice nutrition profile. Healthy Choice Simply Steamers in the frozen section, Purple Carrot Meals also in that individually packaged frozen section, and then Bird's Eye Power Blends, which tend to be different mixes of vegetables and beans and some type of sauce. If anybody has questions for probiotics and prebiotics and learning more just to what to look for, how to decipher the labels, you can check out these 3 websites. Then finally, just as a conclusion slide, just in summary, what do we know and what don't we know? I shouldn't say what don't we know, but what requires further research. What we know is that the gut microbiome plays a role in brain health and neurodegeneration, and it is important, but we're still learning exactly how to access it for the most benefit. Diets high in processed, fried, and sugar-rich foods and low in plant foods favor that gut dysbiosis, which in turn favors inflammation in the body. We know that a long-term exposure to a plant-based diet is brain protective, and that the Mediterranean DASH and MIND diet show the greatest efficacy for their neuroprotective benefits. What we need a little bit more research on is going to be prescribing and recommending probiotics for disease prevention, uncovering the exposome. I didn't hit this too hard, but just the sum of environmental exposures that could impact our brain health. This includes things such as pesticides, pollution. There's quite a long list, and trying to figure out how they all factor in. And then we just need more research to identify the mechanisms involved in the microbiota mediated gut-brain axis or gut-brain communication. We've started the human studies, but we still lack robust human studies, and a lot of our information is still informed by rodent or animal studies. So it is exciting to be able to move forward from here and just continue to learn in humans.
Excellent. Well, Bailey, that was a wonderful presentation. You truly covered a lot of important information, anywhere from, the science behind this gut-brain connection. I learned a lot about the difference between probiotics and prebiotics and the foods that perhaps we can consider incorporating in our diet. You went over very practical, tips on how to start and where to go from here. There are a few more questions, and I actually like one of those. Perhaps to start there, because I heard now multiple nutritionists and registered dietitians talk about frozen foods and frozen vegetables and even canned vegetables. And I always heard this catch-22. From one hand, you have the nutrients that you get with the vegetables. Perhaps sometimes also they're more affordable, which is important to know for some patients with difficulty swallowing or chewing due to, let's say, Parkinson's disease, or even multiple sclerosis. Sometimes those canned vegetables could be softer, and which are kind of helpful. But on the other hand, you have the salt. So how do you deal with that?
With the salt, a lot of canned vegetables benefit, and it's quite effective to just give them a good rinse. You can put them in a colander or strainer, soak them or rinse them thoroughly, or soak them thoroughly in water and give them a good drain. That's going to knock a lot of the salt off. I don't think it's fair to say that fresh vegetables you come home and break down and cook yourself are the healthiest way, because especially if we're weighing the option of, well, if that's the only way to eat broccoli is to bring the whole crown home, break it down and roast it. Well, I can't do that, so I'm just not going to eat broccoli. That's eliminating a really healthy form of exposure if we use the steamer bags, or really not canned broccoli, but canned green beans. And we know that it's going to be healthful. I'm repeating everything you said, but healthful to also consume it in a way that's safe and doesn't pose risks. So I think we need to take the stigma away of what form of vegetable is best and just say, really, any type of vegetable is going to be beneficial. A good rinse is going to knock off a lot of that sodium. And maybe if we're buying frozen vegetables, looking for ones that are made without sauces or do not include sauces, and adding that in your own. If you want some flavor, that's something you can control for when shopping. But it shouldn't be a big deal to rely on fresh or frozen or canned varieties instead of fresh.
Excellent. There is one question about, can antibiotics prescribed for a variety of infections, most commonly UTIs or upper respiratory infections, can they hurt your gut microbiome? And what do you do in case you have to receive antibiotics for a long time? Do you need to take probiotics after that?
Absolutely. That is a beneficial time where it may be helpful to invest in probiotics. Still, the specific strains, duration, dosage is still yet to be determined and fully elucidated. But that would be a good time if you're on that antibiotic regimen. One, boost up your fiber, help build back the probiotics that are still established in your gut. They're likely not all gone. Build up your probiotic foods such as yogurt or kombucha, kimchi, etc. And then studies show it is helpful after a dose of antibiotics to consider taking those probiotics. I've seen studies anywhere from 1 month up to 4 months, and especially with the 4-month duration, could it be restored before then? Sure, but we did see studies after 4 months that the populations were largely restored.
Excellent. We have a question from Adrian from Chicago. It's asking about a whole food plant-based diet and brain health. What are your thoughts on that?
Certainly, we have robust evidence to say a whole food plant-based diet is going to promote brain health because it has antioxidant and anti-inflammatory properties and has many properties that fuel a robust gut microbiome.
Excellent. And there is a question asking about if you have a combination of MS and cancer that was treated with resection or partial resection of lymph nodes, will that change your? It's a very interesting question, and perhaps I can address that, Bailey. It's more of a medical side of things, but one of the good things about the lymphatic system is there is a lot of redundancy, similarly to the nervous system, right? So the networks are designed in a way that even if there is some partial loss of lymphatic tissue due to, let's say, resection as part of treatment for cancer, other areas will likely take over. And so if for the most part, resecting certain lymph nodes in the gut as part of a treatment is not going to necessarily alter immune responses to the level that you have to change your diet just because of that. But of course, you have to be mindful in situations in which you receive medications that are immune suppressants and how that could potentially affect immune responses systemically. I believe that was the last question from the audience. And if that's the case, I want to just express my gratitude to Bailey for sharing your knowledge, your experience. This was a wonderful presentation of a very important topic, so I'm glad you agreed to participate today.
Thank you so much for having me and allowing me to present. It's been a wonderful experience.
And I would like to mirror Augusto's comment on that. Bailey, fantastic job, and such a topic of interest that I think so many of us are keen to get as much information we can. So you covered the topic very well, and it's greatly appreciated. Thank you. And of course, Dr. Miravalle, thank you for being our moderator tonight. And lastly, I want to recognize our sponsors for all of our research clubs in this year's series, which are EMD Serono and Bristol Myers Squibb. We would welcome any of you to continue to stay updated with the information that we post on our website, and particularly as we develop our research club topics for next year. And hope to see you soon. Thanks so much for joining us tonight. Thank you, Bailey.
You're welcome.